Alrighty, we're gonna check provider orders for our patient today. We're gonna see our provider's orders. Looks like there is an order for a blood transfusion. Okay, I'm then going to check and look at our lab values. Look like blood values are low, indicating for a blood transfusion, so that is correct. And then I'm going to also go ahead and check, see if a consent form was signed. Looky here, it has been signed. And then I'm also going to check for blood type and cross match, something like that. And I'm just going to see if that's been done in the last 72 hours, in which it has. Wonderful. Okay, I'm going to go introduce myself to the patient and let them know what's going to happen. All right, knock, knock. Hello, good morning. My name is Elise. I'm going to be your nurse today. Can I have you verify your first and last name and your date of birth?
Yes, it's Robert Crowley, 12/21 is my date of birth.
Wonderful, awesome. Well, good to meet you, Robert. My name is Lise. It looks like we have some orders today to do a blood transfusion. I do have a consent form signed, but I just wanted to verify and make sure that's still okay that we go ahead and do this today.
Yeah.
Okay, wonderful. So some things about it, before I get everything started, we will be doing several vital signs. I will stay in the room with you for the first 15 minutes of the blood transfusion. I'm just going to let you know of some signs and symptoms to look out for as I start the infusion. So if you start having any fever, chills, body aches, headaches, shortness of breath, pain in your back, pain in your chest, itchings, hives, anything like that, please let me know within those first 15 minutes. And then even if it happens after I've left the room, please also let me know. Okay, so I'm going to go ahead and grab my supplies and we'll get started and I'll be back. Alrighty, okay, going to go and grab my supplies. I hand hygiene. I'm going to put on gloves before I touch blood. So I'm gonna grab my blood, make sure that there's no bubbles, there's no clots, it's not expired, and it's not purple, there's no precipitates in it, so everything's looking good there. And I'm going to make sure that I start my infusion within 30 minutes of having picked up the blood from the blood bank. I'm gonna grab the rest of my supplies and head back into the room. Knock, knock. Okay, Robert, I have all of my supplies here. So I'm just going to have a nurse come and verify. I have patient provider orders, just going to verify that the name, date of birth, patient MRN is congruent with the orders, as well as the blood type and cross match. And I'm going to have the nurse verify with me that the tag matches the bag and that the bag matches the patient. Patient name, date of birth, MRN is all the same as the patient identification, and the blood unit number on the tag is the same as the blood unit number on the bag. Is that correct?
Looks good.
Wonderful. We'll both sign off. Alrighty. Okay, so before I get this infusion started, I am going to assess IV patency and get a full set of vitals and chart that. So I'm going to assess IV patency first, so I have my gloves on. So I'm going to check, there's no redness, there's no swelling, there's no infiltration, there's no leaking. Do you feel any pain or tenderness as I kind of gently press around here?
No.
No, wonderful. Okay, I'm going to just assess patency real quick. All right, just making sure that there's no swelling as I'm inserting fluid. Any pain or tenderness at all with that?
Mm-mm.
Okay, wonderful. Okay. And where'd my cap go? Wonderful. All right, so now that all of that is patent, I'm going to go ahead and take a full set of vitals. Everything's looking good. I'm going to document that, and I'm going to get started on our procedure. So start first here, and we will be spiking, doing normal saline first. Okay, so I have my Y connectors here. I'm going to clamp off The one side I'm not going to use, I will later use that for blood, and make sure that this is open as I go ahead and spike my saline. Pick that up. And then I am going to unclamp and let this flow and make sure that it flows all the way through here. Awesome. Okay, going to just clamp this back off and make sure that there is fluid filling the filtration chamber. Okay. All right. Okay, now I'm going to grab my blood bag. I'm going to invert it 2 to 3 times before spiking it. Now I'm going to just, before I spike it, I'm going to clamp off my normal saline and unclamp the line I'm going to use for blood. All right, and before I unclamp, I just want to make sure that I don't waste any blood product. So I'm going to let it go slowly. And clamp off before I lose any blood. All right, okay. We're going to get this hooked up and set up in the system. All right, okay. So I want to infuse 1 ml per minute for the first 15 minutes. So before I get everything hooked up and started, everything's clamped. So I'm gonna get it attached to the patient. They've already been notified of all of the signs and symptoms to watch out for. So we're gonna get started here. And we're doing red blood cells. And we want to infuse 1 ml per minute for the first 15 minutes. Alrighty. And we're gonna get that started. All right, I'm gonna stay in the room with the patient. It's been 5 minutes, so I'm gonna take a full set of vital signs. And Robert, are you feeling any of those symptoms I mentioned earlier? Headache, fever, chills, pain in your back, pain?
No, I'm not feeling anything like that.
Sorry about that. You're not having any itching or rash or anything like that. You're looking great, so feel good?
No, feel good.
Okay, wonderful. We'll simulate that. It's now been 15 minutes. So we're gonna take a whole nother set of vital signs and ask him again if he's feeling any of those symptoms. Sorry about that.
No, I'm not feeling any of those symptoms.
Okay, wonderful. So now I'm gonna go back to the machine here, and we are going to increase the rate so that infuses over 2 to 3 hours, and start that. Alrighty, so now that it is infusing well and he hasn't had any signs of reaction, I'm just going to make sure that the patient is low, locked, side rails up, call light is within reach. Patient's doing good. Press that call light once again if you feel any of those symptoms I mentioned before. I am going to remove my gloves. I'm going to hand hygiene. And I'm also going to be cleaning up my area of all the supplies that need to go to waste. And then I'm going to go ahead and document all the vital signs, the education, and that there wasn't any reactions with the patient during the procedure.